Hi, this is Dr. Lee from Integrative Solutions for an Ankle. Today I want to discuss one of the conditions that are very common to your big toe joint right here. It's called Sesamoiditis, or also known as inflammation of your sesamoid bones. Today I'll explain to you what it is, why you may have it, how we can do to fix it. So stay tuned. There are two small bones right here in your big toe joints. It's called sesamoids. The one that is closer to our mid-body line is called tibial sesamoid. The one that has been located a little more outside is called fibular sesamoids. The sesamoid's job is to stabilize, to help to function the big toe movements up and down here like this. But one of the questions that you might be asking is, why does it get inflamed? And they get inflamed when there is direct contact to the floor too many times and way too hard. By that I mean, if your foot is more of a high arch foot and it's rigid, and there is a lot of propensity or tendency of this part of the foot, which is going to be big toe, hitting the ground constantly, you will be more likely to have inflammation caused by direct contact. So it can happen if you have high arch foot, or if you just simply have a first big toe being down a little bit more than the rest of your toes right here. Also, activities like sprinting, ballet, tennis are one of the few activities that can also cause this kind of motions, having you to slam this part of the foot harder than the rest of the foot. This can also give you more likelihood to have injuries to this area, hence causing sesamoiditis or inflammation of sesamoid bones. The next question you might be asking is this: so what are the symptoms like? How do I know that I have it? Well, let me tell you some of the symptoms you might be experiencing with somebody who has sesamoiditis right here. So if I am moving your big toe joint here and I start to notice you have a lot of pain as I'm moving back and forth, especially when I bring your toes here down here like this, and then when you are experiencing so much pain, this can give me a clue that you could have sesamoiditis pain. Also, if you're having a lot of pinpoint pain around right here or right here where the sesamoid is located, that can also give me a good clue that you might be suffering from sesamoiditis. Sesamoiditis is one of the reasons how you can have big toe joint pain. So please consult with a local provider, local foot and ankle doctors, to see what the cause of your big toe joint pain is. My next question is going to be, how do you treat it? So the treatment of sesamoiditis is going to be very similar of treating an inflamed joint, which is going to be following RICE. Let me explain to you what RICE is. RICE simply stands for R, rest, I, ice, C, compress, E, elevate, which means we are trying as naturally as possible to decrease amount of swelling in the joint. Using the same approach, we can also decrease the amount of swelling on the sesamoid bone right here. Also, your doctor may prescribe orthotics. Orthotics are one of those things that goes between your foot and then your shoes. It's like glasses to your eyes, but for your foot. So think of it as glasses for your foot. Orthotic is supposed to correct any kind of biomechanical dysfunction or malfunctioning of your foot, which means your orthotic is supposed to capture any kind of disadvantage biomechanically on your foot throughout the area. Which means with a proper orthotic that has been dispensed and casted by a doctor, should be able to decrease any kind of disadvantages biomechanically for your foot, and also reduce any kind of stresses that may be occurring right here. And with custom orthotics, your doctor is also able to offload the area where your sesamoid bones are going to be touching your foot. My specialty in foot and ankle is always restoring the proper alignment, and this is no different. In order for you to be able to get the sesamoiditis right here, there has to be a series of biomechanical malfunction, dysfunction in the rest of your foot. If you have dysfunctions in the sesamoid bones and the big toe joint right here, we can also solve it by properly aligning the joint right here. Because the sesamoiditis is going to be localized pain near the sesamoid area, a small amount of steroid injection can be beneficial. I don't recommend this doing more than 3-4 times or so, but 1 or 2 injections to this inflamed joint near the sesamoid can result in relief in pain. As a foot doctor, I see more often than not, the small things like this are often more painful than big joints like this. So I understand and I know how painful sesamoid bones can be, and I have seen through my patient how painful and debilitating the condition can be. So if you've been suffering from sesamoiditis for weeks and then even months at a time, this can definitely be affecting the rest of your body. People with problem right here can start to suffer from low back, mid back, even headache due to this problem. So it is important to approach this foot pain with overall body approach and then treat the entire body for the treatment of the foot pain. So today we talked about what the sesamoiditis is, and we told you how you get it, what kind of sports, what kind of activity can cause you to have that, and how doctors like to diagnose with that. This is Dr. Lee from Integrative Solutions for the Ankle. I hope you found this video to be helpful. If you like, please like and subscribe to this video, and I'll have a lot of contents coming to have more education for your foot and ankle.